Today, we're digging into a really powerful idea from our source material, something they call the cost of cruelty. And it's this notion that some policies have a price that you just can't measure in dollars and cents.
You've definitely heard the argument before, right? That letting the Enhanced Affordable Care Act subsidies expire is just the fiscally responsible thing to do. It's a clean, simple story about saving taxpayer money. But what if that story isn't the whole story?
And that really gets to the core of what we're looking at today. What if this whole idea of savings is just an illusion? What if, by trying to pinch pennies on the front end, we actually unleash a cascade of costs that are way, way bigger for all of us?
Okay, the first shockwave is this number right here, 114%. That's the projected increase in the average premium payment for people on subsidized plans in 2026. I mean, that is a staggering, life-altering figure.
So let's break that down into real dollars. The average annual premium for someone with subsidies is set to more than double, going from just under $900 to over $1,900. For millions of American families, that's not an increase, that's an eviction notice from the healthcare system.
And this isn't some abstract data point. This is the reality for people like Nathan Boy, a father in Orlando who has diabetes. His monthly premium is about to leap from just $28 to over $700. That's a 2,518% rise. And his words say it all. He's being forced to make impossible choices.
So what happens when millions of people are suddenly priced out of their health insurance? It's not just a personal crisis. As the sources detail, it triggers a truly devastating economic chain reaction that ends up affecting everyone.
This is the domino effect, plain and simple. It starts with that premium spike. That pushes millions of people off their insurance plans. But people still get sick, right? And when they do, hospitals get stuck with billions in unpaid bills. That financial strain doesn't just stay inside the hospital. It ripples out, shrinking state economies and costing hundreds of thousands of jobs.
And the scale of this fallout is just staggering. We're talking about nearly 5 million people losing their insurance in a single year. A $7.7 billion surge in care that hospitals basically have to absorb. A nearly $41 billion hit to state GDP. And the loss of almost 340,000 jobs across the country. This isn't just a healthcare crisis. It's an economic catastrophe.
But believe it or not, the crisis doesn't stop there. At the very same time, a second parallel policy failure is creating this devastating financial trap. It's like a 1-2 punch aimed right at the people who fall through the cracks.
And when you put these two things together, you get what the source material calls the poverty pipeline. It's a brutal system. First, you lose your health insurance. Then, an accident or illness leads to medical debt you can't possibly pay. And then, under these new rules, that debt is used to absolutely destroy your credit, blocking you from getting a loan, an apartment, or any real chance at moving up.
And this chart shows you exactly why this is so potent. Historically, medical bills have been the single largest source of debt on people's credit reports. I mean, look at this. It accounted for 58% of all debt in collections back in 2021.
And the damage is very real. Having medical debt show up on your credit report can slash your score by an average of 20 points, sometimes even more. That's the difference between qualifying for a car loan and getting denied, or getting a decent apartment versus being shut out. So, you have to ask yourself, how did we get here? Was this all just a sudden, unforeseen accident, a mistake in policy? Or, as the sources suggest, was this crisis actually engineered over more than a decade?
This timeline really reveals a long, deliberate process. It all started back in 2012 with the Supreme Court ruling that let states opt out of expanding Medicaid. That created this patchwork of coverage that fractured the risk pool and drove up costs. Then, in 2017, the penalty for the individual mandate was repealed, taking away a key reason for healthy people to stay insured. From 2017 to 2020, funding for outreach and enrollment help was absolutely slashed. The failure to extend subsidies is just the final blow. And that recent court ruling allowing medical debt back on credit reports just pours salt in the wound.
So who is most affected by this whole collapse? Well, the data here reveals a really stunning political paradox. 57% of all the people enrolled in the ACA marketplace, the very people who depend on these subsidies, they live in Republican congressional districts. This means the people being hurt the most are often the constituents of the very politicians who have enabled these policies.
And this brings us right back to that original claim about fiscal responsibility. If letting this system collapse creates billions in economic damage and cause hundreds of thousands of jobs, then what is the actually responsible path forward? Well, the sources argue that the real solution isn't about spending. It's about smart investing. Things like permanently extending the tax credits to stabilize the market, restoring protections to keep medical debt off credit reports, basically to stop a health problem from becoming a financial death sentence. The core idea is simple. Investing in public health saves both lives and money. Turns out, compassionate policy is sound economic policy.
Which leaves us with one final question. When a policy that is sold as a saving results in lost jobs, shuttered hospitals, ruined credit, and shattered lives, it forces all of us to ask, what is the true cost of cruelty?